Joyce N. Thomas, RN, MPH, PNP, FAAN, is a national and international pioneer in child welfare, victimization of children, and domestic violence. She is the president and CEO and co-founder of the Center for Child Protection and Family Support in Washington, D.C., and director of Children and Family Institute in Silver Springs, Maryland. She's providing leadership for quality services to children and families. She's also on the board of the National Partnership to End Interpersonal Violence Across the Lifespan.
Good morning, and thank you for paying attention to this very, very important educational program. What I'd like to do is talk about public policy, what makes it effective, how each person has a role to bring information and services to their community. Public policy really is a way to solve overall policies and also problems that may be in the real world. They are guided by various concepts. You hear and see a lot about public policy through our government agencies, through our state agencies, through many, many of our large institutions. Next slide. We talk about issues of violence, and as was discussed, there are many, many interpersonal violences against children that occur. But as we think about what we can do as citizens, as individuals, it's important to understand trauma-informed care and trauma-informed services. This is necessary so that all institutions, whether it's the law enforcement system, the healthcare system, the schools, are all dealing with that very sensitive person who has been traumatized in order not to make it worse and also not to make it repeat. Think about the messages that have been said. You know, we have to make sure we interrupt this pattern, but without interrupting it, we start to see variations in individuals who have experienced trauma in their childhood and in their early years. Policies determine who gets what services, where these services are provided, and when they're available. It's an important part of our social calendar of tools to address the society's needs and the society's must-have. Next slide, please. Let's talk about the healthcare system. We have certainly seen how unfortunate incidents in recent times have brought violence right to the door of the healthcare system. And as we think about health providers, myself being a registered nurse with a long history in pediatrics and adult care, we're there to help. But the system around us, the hospital policies, they must focus on really mitigating the effects of trauma, because we see so many clients, so many individuals, so many patients that come to us who've had prior experiences of trauma. So as we think about this in our communities, and we think about this in terms of policies, we must ensure that the healthcare system is designed to address understanding the ACEs, as it was discussed earlier, the adverse childhood experiences, as well as thinking about what can we do to prevent further trauma to the individual. Next slide, please. So we identify these policies, and we really want to promote informed mental health services in our schools. Hospitals are one, schools are particularly important because this is where an awful lot of trauma and recently has occurred. And it is expected that, and I'm hopeful, that those individuals who've experienced this trauma will have a new thought about a trauma-informed system. That is to look at their own policies and look at how these policies and these experiences can result in toxic environments if they're not addressed. So we have to think about toxic stress, and that includes stress for preventing extreme violence, extreme incidents of repeated trauma, in order to build resilience and in order to address the needs of individuals within the institution. Next slide, please. So as we think about policies, we want to recognize that policies that promote trauma-informed policing, again, is extremely important. Unfortunately, when violence occurs, it occurs in many, many arenas. And so often the first responders may have to come on the scene in a crisis situation. And it is important to refocus and understand what you're doing to ameliorate the immediate problem, but also to not add to the problem by further traumatizing individuals. Obviously, these policies must be able to, particularly with law enforcement, to serve justice and engage citizens in very positive ways. Next slide, please. Keeping again with the institutions, we know that again, there are situations where when an incident, crisis may occur, a trauma, a violence, whether it's gun violence or whether or not it's domestic violence, many times these situations present themselves beyond the police to the court system for decision-making. Again, its focus is to make sure that all along the way where the individual who has experienced the violence is in a situation or in an environment that is protective of them. So prosecutors also need to have a basic understanding of trauma and how it affects individuals to be better able to serve them as well as the victims of crime in a humane way. These policies are needed to provide guidance for prosecutors to assist them to incorporate trauma-informed best practices in their work. And this would enhance the need of really crime survivors, witnesses, people who have been accused of crime, and the entire community. So we're advocating today for, first of all, understanding violence and trauma, looking at how to prevent it, looking at how to treat it. And now as the bystanders or the individuals in the environment, what can be done to, again, to minimize the extra trauma that may occur, and what can we do to move toward resilience and making stronger individuals to confront these issues. Next slide, please. And that takes us to the community. The community is really where policies, all policies really kind of gravitate from the bottom up. Community policies that address trauma of child abuse absolutely must keep in mind the background of those children, the history, the historical trauma that they may be experiencing or may have already experienced. It must be individualized to make sure that their gender, their race, where they're located, and even their language. No one person's going to have all of these skills, but if you're working in a community, you really have to be keeping in mind what is the best way, the most sensitive way to assist individuals who have experienced trauma. Next slide, please. So policies that promote public awareness, policies that have education for communities can help to create safer, healthier environments and provide effective strategies for building resilience. Within the last several months, we have been overwhelmed by the large amounts of violence in our communities. And there is a tremendous effort for pushing for legislative changes, which may be policies or public policies at the national level. we certainly see that these policies are also extremely important on the state level, but they also are important on the individual community level. And this means bringing people together, getting consensus, discussing the ramifications of what has happened, looking at ways and strategies to move forward, and also to begin to look at healing and resilience. And this is what we want to build. So if future incidents may occur, there really is this need to recognize what to do. Next slide, please. As I mentioned, individuals and communities must demonstrate an active role in allocating resources. It does take time, it does take money, it does take resources of all kinds, whether or not it's meeting spaces, whether or not it's opportunities for developing programs, opportunities to provide training. All of this involves the community. And so the community really must have a firsthand look at how to promote resilience, to understand trauma, to rule out adverse experiences that may have occurred with young people or even older people, as was discussed. Trauma policies that promote information and informed care in their jurisdiction is what we're seeking to accomplish. Next slide. So I've tried to just walk through these issues of policies, but there's a number of areas and a number of places that we can go for information. And having been involved with the National Partnership to End Interpersonal Violence, there are trainings, webinars, programs, there are individual practitioners, there are action groups where we are constantly looking at and really trying to establish effective ways, best practice ways to reduce the stress and trauma that individuals might have. Whether we do this through our direct services with a client or a patient, whether we involve our institutions, our healthcare systems, our educational institutions, our law enforcement institutions, our courts, all need to be informed about trauma-informed care. And certainly we know that this is an ongoing effort, and this effort really brings us to making it a part of our everyday life to understand. So training is necessary, education, public awareness, and our hope is that as we look at the public awareness aspect, that we're able to do this on all levels throughout the country, because people use different forms of media to get information. And so we have to examine ways of getting the message out that we really want to reduce trauma, the impact of trauma, and certainly to promote resilience and to design systems and policies that are safe. Thank you.